Hi everyone, Dr. Timothy Gallagher here.
And Dr. Michael Marciello.
And we're from Maragal Medical. This week we're actually going to talk to you about some regulatory updates with what are called human cellular tissue products, or HCTPs, commonly the Wharton's jelly allograft injections and the PRP injections that we do in our practice for regenerative medicine. This is going to be some great information about why Maragal Medical really leads the charge in staying with what FDA has set up in terms of compliance to do these injections with our patients. This is going to be some great information, so stay tuned. Okay, Dr. Mike, we've had some confusion and some questions that have come up with some patients and some providers regarding FDA's role in approving these Wharton jelly allograft injections as well as PRP, and just a little history. And I just thought that this would be a good opportunity to explain in simple terms for the public about these injections, the regulatory background, and why these injections are safe. So to clarify, what is FDA's role in this whole thing when it comes to human cellular tissue products?
Well, FDA stands for Federal Drug Administration. It's an agency that controls the safety profiles of our drugs and our materials that we get in relation to medications and procedures that are done for medical treatments.
Right. And back in 2016, when they approved human cellular tissue products or birth tissue products to be used as a source of regenerative cells, or to correct what's called a structural defect. So I always like to explain, like, a structural defect is commonly a change or degeneration. An example would be in an arthritic joint, where maybe you have that arthritic change, or maybe in the knee, a meniscus tear, or maybe in the shoulder, a partial rotator cuff tear. These allografts are allowed to be used to help repair some of that damage. And what FDA did is they went through an observation period while they were collecting data, and that lasted through 2021. Now, I think it's helpful for the public to understand FDA's approval with drugs falls under what's called a 351 classification. FDA's rule when it comes to human cellular tissue products is a 361 classification. So FDA doesn't need to approve these amniotic or Wharton's jelly allografts, but they've already established that they're safe for humans, and that they've established you're able to use these for patients that have those structural defects as long as it falls under 3 categories. So these tissues can't be manipulated, so they have to be minimally manipulated, which means they need to come in their natural state. They also need to be used for what's called homologous use. So it needs to be used to help correct what those tissues already do. So when it comes to the Wharton's jelly, that's a layer in the umbilical cord that protects those blood vessels. And that definition falls nicely into what we're able to use these allografts for, to help to protect the damage or the structural defect that occurs. And it needs to be, direct. It can't be systemic. So in the beginning, a lot of clinics, including ours, we're trying under FDA's rules. We could do an infusion, which was systemic, but now they've clarified that, and we need to stay within that role. So I think that's a confusion. Patients often ask us, is this FDA approved? And it's not necessary to get FDA approval for 361. FDA's already established that. They need to make sure that obviously the lab is doing things correctly, and it would be the lab, in our case we use Regenative labs, that has that certificate from FDA.
Yeah, and to try to just make it in a more simplistic aspects of thought is, there's many different regulations, of course, in government agencies, but 361, we come down to these materials are essentially, allograft means a tissue transplant, or you think about a big tissue transplant that people have heard of, like you get a donation of a kidney and a kidney transplant, it falls under those same rules.
Yeah.
So that's why they can't be manipulated, because it has to be in its natural form. And then it has to be directly given to where the problem is. If you have a kidney transplant, you put it back in the space where you need your kidney.
Right.
If you have a shoulder problem, you got to directly inject into your shoulder.
Right.
And so that's the idea, that the safety profile that the FDA is responsible for is not to say that it's approved for the injection into the shoulder. It says the material is safe, handled correctly under tissue bank properties and, again, government regulations. And that's why the FDA regulate the laboratory, not the procedure. Medications are very different. Medications are required, again, under this 351 rule,
Right.
that you have to have science and research and many years of proven capabilities that it does what it's supposed to do well before it can come out into the public's eye.
Yeah.
And that's the big difference. They're both safe, but a medication has to be pre-approved and done research beforehand. A tissue bank product transplant, or so-called, again, our allograft, has to be safe. The laboratory has to be FDA regulated and approved, and then we can use it for that tissue defect wherever it may be in the person's body.
Yeah, and it even goes through an even stricter protocol with the American Association of Tissue Banks to make sure it's safe as well. And this too there's a great link that you're going to see below too. If you want some more information, the lab's lead counsel, attorney Rob Castle, he works for Duane Morris, which is the largest law firm in the country. They have expertise in FDA regulation, particularly when it comes to using these types of products with our patients, as well as Medicare regulations as well. If you need additional information, it's a great little 2-minute video that you can click on the link below. So that's it for today. We just wanted to clarify some of the questions that have been coming up on whether or not you need FDA approval for these Wharton's Jelly allografts. If you have any questions, feel free to reach out to us. More information can be found always on our website at maragalmedical.com. We're proud to say that we're New England's first and only integrated medical practice where we combine medical care, physical therapy, and chiropractic treatment under one roof. And we have some exciting programs, including a whole food medical weight loss program, which we're seeing great results with, and a neuropathy program that is FDA approved, which we're really excited about. Most insurances cover that. And if you want information, the website's a great resource, as well as our YouTube page. Please consider subscribing to that. A lot of great information. Well, that's it for today. I hope you learned something. I hope that clarified maybe some of the questions that come up with FDA's role in the Wharton's Jelly allografts. Have a great day, everybody.
Take care.